However, in Grand Bahama, the fight continues to prevent the spread of COVID-19. And while there has been no new cases in the past 2 weeks, health officials say we are not in the clear just yet. The island's chairperson for Health Services COVID-19 Task Force provides this update. Here's Ramiko Knowles.
The number of cases in Grand Bahama stands at 7. Chairperson of the Grand Bahama Task Force Health Services, Frank Bartlett, says it is unfortunate that 2 persons died and notes that the remaining 5 patients testing positive for COVID-19 showed mild symptoms and did not require extended hospitalization.
The 2 persons that were deceased were an 80-year-old male. He would have been in hospital for several days prior to this being deceased on April 4th. The second was a 51-year-old female who passed on April 6th. All of the other patients who have tested positive have been managed at home, and they're doing very, very well at home. One of the cases that are reported in the Grand Bahama figures is a patient that would have been transferred from Freeport into Nassau, so we're not having any direct care in that patient. But otherwise, our patients so far are doing very, very well.
The island's latest patient testing positive for COVID-19 is a 25-year-old male and is the son of the deceased patient that passed on April 6th. Bartlett says he too is doing well and should be released later this week.
One of the things we want to reiterate from Grand Bahama Health Services is that even though we have only 7 patients, this is no time to be relaxing our public health and our social measures. The public health measures basically means that you still want to be doing hand washing, the cough etiquette. We are required to wear a mask whenever we're out in public, and we want to make sure we adhere to that part of it. As it relates to social measures, we want to enforce, again, minimizing travel. We're supposed to be on lockdown. We want to be making sure that we maintain our social distance. That has been reiterated over and over by from the political side and also from the health arena.
Now, while the lockdown measures seem to be having a positive impact mitigating community spread, Bartlett says there are some challenges and they're in need of the public's assistance.
At times when we are called from home, we don't get a very clear representation as to what the call is about. And sometimes the calls, we get a call, for example, for some minor ailment to find that they would have had chest pain or shortness of breath. Or we find that when they're being interviewed, the story is completely different from what they would have given the ambulance department. The healthcare workers are on the front line. They need to know exactly what they're dealing with when they go to pick up patients. So it's very, very important that as much as possible you represent exactly what the problem is when you are calling for assistance from the healthcare workers.
Over the past 2 weeks, he says the majority of calls coming into the health services and EMS hotline has been non-COVID related. On average, he says they may receive about 4 to 6 calls per day with persons complaining about respiratory illnesses. Ramiko Knowles, ZNS Network News.
Well, still ahead in the morning edition, the National Insurance Board and how it's meeting the needs of thousands during COVID-19. You're with the morning edition. Stay with us.